So once we get that interval, we tend to go to the humeral shaft either by blunt dissection or sharp dissection. I prefer blunt dissection by my fingers. We can use a blunt periosteum to dissect all those things and to reflect deltoid on the lateral surface or laterally. And then we identify the lighthouse of shoulder, which is called as long head of biceps. So anything on the lateral side of long head of biceps will be our greater tuberosity, and anything on the medial side will be a lesser tuberosity. Now next comes to the tagging of GT and LT. Probably we can tag supraspinatus and infraspinatus on GT, and we can tag LT with a non-absorbable thread, which we will incorporate into the plate in later on stages. We can use this holding stitch and pull the greater tuberosity towards the incision to have a proper tagging.